The blood on her hands had stopped bothering her years ago, but the silence afterward never did. Dr. Elena Vasquez stood in the empty parking lot of Fort Brennan Regional Medical Center at 2:47 a.m., watching her breath crystallize in the February air. The military hospital rose before her like a concrete fortress, its windows glowing with the harsh fluorescent light that marked every government building she'd ever entered. Somewhere inside, soldiers were bleeding, dying, fighting for every breath, and she was about to walk back into the world she'd sworn she'd left behind. If you want to hear more stories like this, subscribe to the channel right now, and tell me in the comments, where are you listening from tonight? She adjusted the strap of her medical bag, feeling the weight of instruments she'd carried across 3 continents. The graveyard shift had been her choice. Fewer questions that way. Fewer eyes tracking her movements, cataloging the small inconsistencies that would eventually give her away. The automatic doors hissed open. Inside, the smell hit her immediately. Disinfectant barely masking blood. The metallic tang of trauma bays running 24-hour cycles. The particular scent of military-grade antiseptic she'd recognize anywhere. Dr. Vasquez. The voice was gravel and authority mixed together. Colonel Marcus Harlow stood near the nursing station, arms crossed, his uniform pressed sharp enough to cut. Chief of Surgery. 23 years of service, according to the brief she'd memorized. A man who'd seen enough battlefield medicine to recognize it when it walked through his door. Colonel Harlow. Elena kept her voice neutral, civilian. Thank you for the opportunity. Your credentials are impressive. Harlow's eyes tracked her like targeting systems. Trauma surgery residency in Iowa. Rural hospital experience. Solid recommendations. He paused, letting the weight settle. Almost too perfect for someone requesting night shifts at a military facility. Elena met his gaze without flinching, a mistake she recognized too late. Civilians looked away from colonels. She'd forgotten how to be someone who hadn't spent 8 years taking orders. I prefer quieter environments, she said. Less administrative distraction. Harlow's jaw tightened fractionally, but he gestured down the corridor. Let me show you the surgical wing. They walked past walls decorated with military honors, bronze stars, purple hearts, photographs of surgical teams in desert camouflage. Elena kept her eyes forward, but her peripheral vision caught one frame that made her chest constrict. A ceremony. Afghanistan. 2019. Officers she recognized standing in dress uniforms, their faces frozen in a moment before everything fell apart. You served? Harlow's question came sharp and sudden. No, sir. The lie tasted like copper. My father did. Army, Medical Corps. It wasn't entirely false, just incomplete, like everything else about her now. The surgical suite was state-of-the-art, Level 1 trauma center serving 3 military bases and civilian overflow. Harlow watched as Elena inspected the equipment, her hands moving with unconscious precision. She arranged the instrument tray without thinking. Hemostatic clamps in order of size, scalpels positioned for ambidextrous access, trauma shears within immediate reach. Battlefield triage order. Combat medicine protocol. Head nurse Rachel Park appeared in the doorway, tablet in hand, dark eyes missing nothing. Colonel, we have a patient. Lance Corporal Martinez, 19 years old, acute abdominal pain, likely appendicitis. Dr. Vasquez, you're up. Harlow stepped back, arms crossed again. Assessment mode. Show me what Iowa taught you. The young Marine lay on the gurney trying to look tough, despite the pain etched across his face. Elena performed the examination with textbook precision, palpating the abdomen, checking rebound tenderness, ordering labs and imaging. Clean, efficient, unremarkable. Except her hands moved too fast. From the observation deck above, Colonel Harlow leaned against the glass, watching those hands work with the fluid efficiency of someone who'd performed emergency surgery in the back of moving vehicles, who'd operated under mortar fire, who'd learned to work faster because seconds measured in heartbeats were the difference between soldiers going home alive or in flag-draped boxes. Classic appendicitis, Elena announced, stripping off her gloves. Needs immediate surgical intervention. Nurse Park nodded, but her expression carried questions she didn't voice. Not yet. As they prepped Martinez for surgery, Elena felt the familiar weight settling over her shoulders. The responsibility of holding someone's life in her hands. The muscle memory of procedures she'd performed hundreds of times in places that officially didn't exist. The surgery took 47 minutes. Textbook. Perfect. Completely unremarkable. Except Colonel Harlow stood in that observation deck for all 47 minutes, watching a civilian surgeon work with the precision of someone trained for combat, and wondering exactly what kind of ghost had just walked into his hospital. The call came at 4:17 a.m. Convoy accident on Route 9, 8 casualties incoming, ETA 6 minutes. Fort Brennan's trauma bay erupted into controlled chaos. Nurses prepping stations, residents checking equipment, the organized rush of people who'd trained for exactly this scenario. Elena stood near Bay 3, pulling on gloves with movements so automatic they felt like breathing. Multiple GSW from training exercise gone wrong, Nurse Park announced, reading from the dispatch tablet. Command says live rounds got mixed with blanks. We've got penetrating trauma, possible internal bleeding. The ambulances screamed into the receiving dock. Doors burst open. Soldiers on gurneys, some screaming, some ominously quiet. Blood everywhere, on uniforms, on medic hands, pooling on transport sheets. Colonel Harlow took command immediately. Standard triage protocol. Critical patients to bays 1 and 2. Stable patients to 3 and 4. Move. Elena watched the organized chaos with practiced eyes. A private with through-and-through shoulder wound, painful but survivable. A corporal with abdominal penetration, critical immediate surgery. A specialist with leg fracture, stable, secondary priority. And then she saw him. Sergeant David Kessler sat on a bench near the far wall, 30 feet from the main triage area. Mid-30s, Ranger tab visible on his torn uniform. No blood, no obvious wounds. Vitals on the monitor beside him showed stable. Heart rate 88, blood pressure 125/80, oxygen saturation 96%. Everyone walked past him. Not because they didn't care, but because 8 other soldiers were bleeding, screaming, dying. Standard triage meant treating the obvious emergencies first. But something was wrong. Elena's training, the real training, the kind that happened in forward operating bases under mortar fire, screamed warnings her conscious mind hadn't yet processed into words. The way Kessler sat perfectly still, despite the chaos around him. The shallow, controlled quality of his breathing. The subtle distension of his neck veins that nobody else was close enough to see. She crossed the trauma bay before thinking about consequences. Sergeant Kessler? Elena knelt beside him, eyes cataloging details invisible from a distance. I'm Dr. Vasquez. Were you in the convoy? Yes, ma'am. His voice was steady, calm, too calm. Blast threw me against the vehicle frame. Just got my bell rung. I'm fine. You should help the guys who actually need it. Elena was already pulling her stethoscope from her pocket. Let me check your lungs. Quick assessment. She pressed the diaphragm against his right chest. The breath sounds were diminished, drastically diminished. Left side normal, right side almost silent. Her fingers found his radial pulse. Thready, rapid. His skin felt cool and clammy despite the heated trauma bay. Sergeant, I need you to stay very still and listen carefully. Elena kept her voice level even as her hands moved to her trauma bag. Your right lung has collapsed. Air is filling your chest cavity, compressing your heart. You're minutes from cardiac arrest. What? But you feel fine because you're a ranger, and your pain tolerance is extraordinary, but your body is compensating, and it's about to fail. She was pulling supplies now. Betadine, lidocaine, a 14-gauge needle long enough to reach the pleural space. Across the bay, Nurse Park looked up. Dr. Vasquez, what are you? Tension pneumothorax, right side. I'm decompressing now. Colonel Harlow's voice cut through the noise. Blake, you need authorization for that procedure. Step back and let me assess. Elena found her landmark. Second intercostal space, mid-clavicular line. By the time you assess and authorize, he'll code. I'm doing this. That's a direct. She inserted the needle with the smooth confidence of someone who'd performed this procedure dozens of times under fire. The rush of air was immediate and audible. Trapped pressure releasing from the pleural cavity with a hiss that confirmed everything she'd known from the moment she saw him sitting too still, too quiet, too close to death. Kessler gasped, color flooding back into his face. Jesus, I can breathe. I couldn't breathe before, but I didn't even realize. Shock masks perception. Elena was already securing the catheter, monitoring his response. Your vitals are stabilizing. You're going to be fine. The trauma bay had gone silent. 8 medical professionals staring at the civilian surgeon who'd just saved a life nobody else had recognized was in danger. Colonel Harlow stood frozen, jaw tight, eyes moving between Elena and the patient, and the needle decompression she'd performed with the casual efficiency of a combat medic. Nurse Park approached slowly, voice quiet enough that only Elena could hear. That assessment. The way you moved. Where did you really train, doctor? Elena met her eyes without flinching. Iowa. Rural hospitals. You see a lot of variation in presentations. Iowa. Park's tone made it clear she didn't believe a word. Rural hospitals teach you to recognize tension pneumothorax in compensating patients from 30 feet away. Before Elena could answer, Harlow's voice cut between them. Dr. Vasquez, my office. Now. But as Elena followed him out of the trauma bay, she caught Sergeant Kessler's eyes. He was watching her with the particular intensity of someone who'd worked with special operations medics, who recognized combat medicine when his life depended on it. And she knew, with absolute certainty, that her carefully constructed cover had just developed its first fatal crack. By morning shift change, the story had spread through Fort Brennan like wildfire. The new surgeon, the one who'd spotted a tension pneumothorax from across a crowded trauma bay, who'd saved Sergeant Kessler's life while everyone else walked past him. Nurses whispered about it in break rooms. Residents debated it over coffee. And in the quiet spaces between emergencies, people started watching Dr. Elena Vasquez with something between admiration and unease. She felt the weight of those eyes following her through corridors, cataloging her movements, measuring the distance between what her credentials claimed and what her hands actually knew. Elena was reviewing lab results in the physician's lounge when the page came through. Consultation requested, Neurology Department, Captain Andrew Fisher, 29 years old, fighter pilot, presenting with severe migraine and nausea. The neurology resident, Dr. Marcus Webb, fresh out of his fellowship and confident in his diagnostic protocols, met her outside the examination room with a dismissive wave. Honestly, I don't know why they paged surgery. Classic migraine presentation. We're discharging him with sumatriptan and follow-up in 2 weeks. Something in his casual certainty made Elena's instincts flare. Mind if I take a look? Webb shrugged. Knock yourself out, but we've already cleared him. Captain Fisher sat on the examination table, flight suit unzipped to his waist, pressing fingers against his temples. Young, fit, the kind of pilot who'd passed dozens of rigorous medical examinations to earn his wings. Not someone who should be having migraines severe enough to ground him. Captain, how long have you had the headache? Elena kept her voice conversational while her eyes tracked details Webb had missed. Started about 6 hours ago. Came on sudden. Worst headache of my life. Fisher's words came slowly, carefully, like someone concentrating hard on simple tasks. Worst headache of my life. The phrase that should have made every physician in the room stop and reconsider. Elena pulled his chart, scanning the intake notes. Blood pressure slightly elevated. Pupils equal and reactive. Neurological exam unremarkable. Everything pointing toward benign migraine, except for one detail buried in the nursing notes. Patient reported brief episode of double vision at onset, resolved within minutes. Dr. Webb, did you see this note about diplopia? Transient visual disturbance. Webb's tone carried the edge of someone whose judgment was being questioned. Classic migraine aura. Textbook presentation. Elena turned back to Fisher. Captain, I need you to do something for me. Touch your chin to your chest. He tried, winced, stopped halfway. Hurts. Neck's really stiff. And this started suddenly? No gradual buildup? I was in the simulator. 1 second I'm fine. Next second it's like someone drove a spike through my skull. Elena's hands were already reaching for her phone. Dr. Webb, we need emergency imaging. CT angiography. Now. For a migraine? Webb's voice rose. That's completely unnecessary. Captain Fisher is young, healthy, no risk factors for... He has sudden onset severe headache, transient diplopia, and nuchal rigidity. Elena's tone left no room for argument. That's not migraine. That's a sentinel bleed from an aneurysm. And if we discharge him, he'll be dead within 24 hours. The color drained from Webb's face. You can't possibly know that from... I'm ordering the scan. You can file a complaint later. 40 minutes later. Elena stood in radiology looking at images that confirmed everything her training had screamed from the moment she'd seen Fisher's chart. Cerebral aneurysm, posterior communicating artery, already showing signs of minor bleeding. The scan showed a bulging weak spot in the vessel wall, stretched thin, hours or maybe minutes from catastrophic rupture. My God. Webb stared at the screen, his earlier confidence evaporating. If we'd sent him home, get him to OR prep now, and Page neurosurgery. Tell them we have an emergency aneurysm repair. Elena was halfway down the corridor when Colonel Harlow's voice stopped her cold. Dr. Vasquez, a word. His office was sparse, military efficiency without decoration. Harlow closed the door with deliberate care, then turned to face her with an expression that mixed frustration and calculation. 2 unusual diagnoses in your first 8 hours. Sergeant Kessler. Now Captain Fisher. He crossed his arms. Most surgeons go entire careers without catching presentations that subtle. You've had 2 in 1 shift. Pattern recognition improves with experience, sir. Experience. Harlow stepped closer, voice dropping. Your technique during that needle decompression. That was combat medicine. The way you moved during the convoy casualties. That was battlefield triage. And this diagnosis? He gestured toward radiology. That's the kind of assessment I've only seen from surgeons who've worked mass casualty events where missing something means body bags. Elena held his gaze. I had excellent mentors in Iowa. Iowa? The word hung between them like an accusation. Iowa doesn't teach you to work like someone who's operated under fire. Iowa doesn't give you the instincts to spot sentinel bleeds that board-certified neurologists miss. He paused. Where did you really complete your surgical residency, doctor? The silence stretched. Down the hall, alarm sounded as Fisher was rushed to emergency surgery. Lives being saved by assessments that Elena's training, her real training, had made second nature. Iowa, she repeated quietly. Everything in my file is accurate, Colonel. Accurate isn't the same as complete. Harlow's jaw tightened. I'll be watching you, Dr. Vasquez. Very closely. As Elena left his office, she knew the cracks in her cover were spreading faster than she could contain them. And somewhere in the hospital, Nurse Park was probably already making calls, asking questions, digging into the 8-year gap that Elena's carefully constructed credentials couldn't quite hide. The explosion at Training Range 7 tore through the afternoon quiet like the hand of God reaching down to remind everyone that war didn't care about schedules. Elena was reviewing post-op notes when the hospital-wide alert screamed through every speaker. Mass casualty event, Range 7, multiple blast injuries, 23 casualties incoming, all surgical personnel report immediately. The trauma bay transformed within seconds. Every available doctor, nurse, and medic flooding into position. Gurneys lining the walls. Equipment carts staged for rapid access. The organized chaos of a Level 1 trauma center preparing for war. But this wasn't organization. This was panic wearing a professional mask. Elena saw it in the residents' eyes. The fear of being overwhelmed, of making the wrong call, of watching people die because the system couldn't process casualties fast enough. She'd seen that same fear in forward operating bases when the wounded outnumbered the hands available to save them. The first ambulance arrived. Doors burst open. A soldier with half his face burned away. Another, with a leg hanging by shreds of tissue. A third clutching intestines that had pushed through his abdominal wall. Triage stations. Colonel Harlow's voice cut through the noise. Critical to Bay 1. Urgent to Bay 2. Stable to... No. Elena's voice wasn't loud, but something in her tone made everyone stop. That's not how you process this volume. Harlow turned, eyes flashing. Dr. Vasquez, this is not... You have 23 casualties incoming with more equipment and personnel than patients. Standard triage will create bottlenecks and kill the salvageable. Elena moved to the center of the bay, instinct overriding caution. 4-tier battlefield protocol. Expectant, critical, urgent, minor. I'll call triage. You execute. You don't have authority to... The second ambulance arrived. Then the third. Soldiers screaming, bleeding, dying on gurneys while command structure debated protocols. Elena made a choice that would either save lives or end her career. Red tag, Bay 1. She pointed to a corporal with penetrating chest trauma. Yellow tag, Bay 3. A specialist with compound leg fracture. Green tag, hallway holding. Walking wounded with superficial burns. Her hands moved faster than conscious thought, assessing injuries with ruthless efficiency learned in places where hesitation measured in body counts. Harlow started to protest, then saw his staff responding. Residents following Elena's calls, nurses moving with purpose instead of panic, the chaos organizing into something that actually worked. And then they brought in Private Chen, 19 years old, blast trauma to the chest. No pulse, no respirations, pupils fixed and dilated. 2 senior surgeons looked at him, checked monitors showing flatline, and started to move away. Expectant, one of them called. He's gone. Focus on the ones we can save. Elena looked at Chen's face. Baby fat still visible under the dust and blood, dog tags hanging from his neck showing a birth date that made her chest constrict. Somewhere a mother was about to get a phone call that would destroy her world. Unless. Clear the hallway. Elena grabbed a thoracotomy tray, moving before anyone could stop her. I need 2 units O negative and a crash cart, now. Dr. Vasquez, he's already... Nurse Park's voice carried warning. He's 19 years old, and I'm not calling time of death until I've exhausted every option. Elena sliced open Chen's chest in the middle of the ER hallway, her hands moving with the practiced precision of someone who'd done this dozens of times under circumstances that made a hospital corridor look safe. The entire trauma bay went silent. Doctors stopped mid-procedure. Nurses froze with supplies in hand. Everyone watching the civilian surgeon perform a field thoracotomy. Cracking ribs. Opening the chest cavity. Reaching inside with bare hands to manually compress a heart that had stopped beating. Come on, Chen. Elena squeezed the cardiac muscle in rhythm, feeling the texture of tissue hovering between life and death. You don't get to die in training. That's not how this works. 30 seconds. A minute. 2 minutes of Elena manually pumping blood through Chen's body while everyone watched with expressions ranging from horror to awe. The monitor blipped. Once. Twice. A rhythm establishing itself. Chen gasped, his body arching as his heart remembered how to beat on its own. The trauma bay erupted in controlled chaos again, but this time with Chen stabilized and moving toward emergency surgery instead of the morgue. Elena stood in the hallway, blood up to her elbows, chest cavity still open requiring closure, and met Colonel Harlow's eyes across the room. His expression had transformed from frustration to something else entirely. Recognition mixed with certainty that everything he'd suspected had just been confirmed. My office, he said quietly, as soon as Chen is stable. An hour later, Elena sat across from Harlow in his office while he paced like a caged predator. That procedure, his voice was dangerously controlled. Field thoracotomy. I've seen it performed exactly once in my entire career. Afghanistan 2019, forward operating base under siege. The surgeon who did it saved 12 lives that night using techniques that don't exist in any civilian training program. Elena said nothing. Who the hell are you, Dr. Vasquez? Harlow stopped pacing, leaning both hands on his desk. And don't tell me Iowa. Don't insult my intelligence. The silence between them held the weight of 8 years of secrets that Elena had carried across continents, believing she could bury who she'd been beneath who she pretended to be. But some skills couldn't be hidden. Some instincts couldn't be unlearned. And somewhere in this hospital, Private Chen was breathing because Elena had forgotten, just for a moment, to be anyone other than exactly who she was. Elena left Colonel Harlow's office without answering his question, and both of them knew the silence spoke louder than any lie she could have constructed. For 3 days, she worked her shifts with the growing awareness that walls were closing in. Harlow watched her from observation decks. Residents whispered when she passed. And Nurse Rachel Park had started asking questions that felt less like curiosity and more like investigation. On the 4th day, Park cornered her in the supply room. Your credentials check out, Park said quietly, tablet in hand. Medical degree from Johns Hopkins. Surgical residency completed in Iowa. State licenses current. References impeccable. She paused. Except there's an 8-year gap in your employment history. Between 2015 and 2023, Dr. Elena Vasquez doesn't exist in any database I can access. Elena kept sorting supplies, hands steady despite the acceleration of her pulse. I took time off. Personal reasons. 8 years. Park's voice carried no accusation, just certainty. That's not time off. That's a different life entirely. Before Elena could respond, the hospital intercom announced visitors. Medical Review Board conducting trauma outcome assessments. Standard procedure, but the timing felt deliberate. The delegation arrived that afternoon. 6 physicians in civilian clothes evaluating Fort Brennan's mortality rates, surgical protocols, and success metrics. Elena watched them tour the facility from a distance, keeping to the surgical wing, avoiding the cafeteria where they gathered for lunch. But one of them kept staring. Dr. Samuel Chen, according to his name badge. Mid-50s, carrying himself with the particular posture of someone who'd worn a uniform before trading it for civilian credentials. Every time Elena glanced toward the delegation, his eyes were tracking her across the space with an intensity that suggested recognition rather than casual interest. That evening, during rounds, Elena treated a patient who made her careful isolation impossible to maintain. Staff Sergeant Michael Cross, Special Forces, presenting with infected shrapnel wounds from an overseas deployment. The kind of injuries that required experience with combat trauma and understanding of battlefield contaminants. Elena debrided the wounds with efficient precision, her hands recognizing the pattern of fragmentation damage even as she kept her expression neutral. "You've done this before," Cross said quietly. Not a question. A statement from someone who'd been treated by enough combat surgeons to recognize the technique. "Standard wound care, Sergeant." "No." He met her eyes with the directness of someone who'd survived by reading people accurately. "That's tactical medicine. The way you assessed the debris pattern, checked for secondary fragments, the order you cleaned the wound track, that's field protocol." He paused. "Who did you serve with, ma'am?" Elena's hands didn't falter, but something in her chest constricted. "I'm a civilian surgeon, Sergeant Cross." "Right." His expression said he didn't believe a word. "And I'm just a staff sergeant who happened to notice you work exactly like the surgeon who saved my entire team in Kandahar." The respect in his voice was unmistakable. "Whoever you are, whatever you're running from, thank you. For Chen, for Kessler, for Fisher. Thank you." Elena finished the dressing in silence, the weight of gratitude somehow heavier than accusation. That night, exhausted from a 16-hour shift, she opened her locker to find a folded piece of paper tucked into her jacket pocket. The handwriting was precise, almost surgical. "I know who you are. We need to talk. Tomorrow, Aero 200 hours, Surgical Wing Corridor B. Come alone. SC." Elena stared at the note, recognizing the initials. Dr. Samuel Chen from the Review Board. A physician who watched her with the particular recognition of someone who'd seen her face before, in different circumstances, wearing different insignia. She crumpled the note in her fist, knowing that tomorrow would force a choice she'd been avoiding since the moment she'd walked through Fort Brennan's doors. Continue running from who she'd been, or finally face the truth about why she'd disappeared. Outside her locker, the hospital hummed with its usual night rhythm. Monitors beeping, nurses making rounds, soldiers healing from wounds visible and invisible, and somewhere in the building, Dr. Chen waited with answers to questions Elena had spent 8 years trying to forget. The surgical wing at 2 a.m. belonged to ghosts and secrets. Elena walked through corridors lit only by emergency lighting, her footsteps echoing against tile floors that had witnessed more blood than anyone wanted to count. Corridor B stretched empty before her, sterile and cold, the kind of place where truths got spoken, because there was nowhere left to hide them. Dr. Samuel Chen stood near the observation window overlooking the main operating theater, his silhouette backlit by the glow from the surgical suite below. He didn't turn when Elena approached, just kept staring down at the empty table where she'd saved Private Chen's life 3 days ago. "I was in Afghanistan in 2019, he said quietly. "Army surgeon assigned to Forward Operating Base Vanguard. Worst deployment of my career." He paused. "Also the most important." Elena stopped 10 feet away, every instinct screaming to run. But she'd been running for 8 years. and exhaustion finally outweighed fear. "I don't know what you think You're Captain Elena Reyes." Chen turned to face her, and his expression held no accusation, just recognition and something that looked like relief. Bronze Star with Valor, Combat Medical Badge, 47 confirmed saves under fire during a siege that should have killed everyone in that fob. The name, her real name, hung in the air between them like a weapon waiting to discharge. Elena's throat tightened. That person doesn't exist anymore. She's standing right in front of me. Chen stepped closer, voice gentle despite the weight of what he was saying. "The field thoracotomy you performed on Private Chen. That was the Reyes maneuver. You invented it. Taught it to every combat surgeon who deployed after 2019. He paused. "I was one of them. You saved my career before we ever met. You don't understand what happened. I understand you were court-martialed for refusing evacuation orders." Chen's voice carried no judgment. "Command wanted you to abandon 12 critical patients and evacuate with the rest of the medical staff. You refused. Stayed behind for 11 hours under enemy fire, performing surgeries in a tent that was literally collapsing around you." Elena felt the memories flooding back. The smell of burning fuel, the sound of mortar impacts getting closer, the weight of choosing between orders and lives that couldn't survive transport. "They couldn't be moved," she whispered. 3 with open chest wounds, 4 with active hemorrhaging, 2 in the middle of emergency surgery. If I'd evacuated, they would have died within the hour. So you stayed. Chen's tone made it statement, not question. Operated through a firefight. Stabilized all 12. And when reinforcements finally arrived, every single patient was alive. And the military tribunal called it insubordination. The bitterness in Elena's voice surprised even her. "My commanding officer called it betrayal of duty. Endangering the mission for personal heroics. What did you call it? Triage." The word came out harder than she intended. "I called it making the only choice that let me look at myself in a mirror afterward." Chen nodded slowly. "For what it's worth, every combat surgeon I know considers that night legendary. You prove that surgical standards don't have to drop just because bullets are flying." He paused. "But you disappeared. After the court-martial, after the discharge, you just vanished. I couldn't practice military medicine anymore. So I became someone who could practice civilian medicine instead." Elena's hands clenched. 8 years building a new identity, new credentials, a new life, and you're going to destroy it in one conversation. "I'm not here to destroy anything." Chen's voice carried unexpected warmth. "I'm here to warn you. General Marcus Blackwood is arriving next week for Fort Brennan's annual inspection." The name hit Elena like physical impact. Blackwood, her commanding officer in Afghanistan. The man who'd stood in that tribunal and called her actions reckless, who'd watched her career burn and done nothing to stop it. "He'll recognize me instantly," Elena said. "The moment he sees you," Chen confirmed. "Which means you have a choice to make. Run again, or finally face what happened." He handed her a folder. "Your real service record. Everything you accomplished before that night. Maybe it's time to stop hiding from who you were and remember why you became a surgeon in the first place." Elena took the folder with shaking hands, feeling the weight of 8 years of secrets finally catching up to her. And knowing that in 7 days, the man who'd destroyed her career would walk through Fort Brennan's doors. And this time, there would be nowhere left to run. Elena spent 6 days preparing to disappear again. New identity documents stored in a safety deposit box. Cash reserves ready for extraction. A rental car parked 3 blocks from the hospital. Keys in her pocket at all times. The same escape protocol she'd established in 4 other cities before Fort Brennan. The careful architecture of someone who'd learned that staying meant exposure, and exposure meant losing everything she'd rebuilt. But every shift made leaving harder. Sergeant Kessler, cleared for active duty, stopping by the surgical wing to thank the doctor who'd spotted what no one else saw. Captain Fisher, back in flight simulators, his aneurysm repaired before it could kill him. Private Chen, recovering in ICU. Alive because Elena had refused to accept that 19 years old was old enough to die. On the 6th night, the medevac helicopter landed with a patient that made running impossible. "Incoming critical." The PA system crackled. Staff Sergeant Malik Torres, 75th Ranger Regiment. Blast injuries, multiple organ failure, massive hemorrhaging. No surgeon available willing to take the case. Elena was halfway to the parking lot when those words stopped her cold. No surgeon willing to take the case. Medical code for, the patient is already dead. We just haven't admitted it yet. She turned back toward the hospital, knowing she was making a choice that couldn't be unmade. The trauma bay looked like a war zone. Torres lay on the gurney, his body a road map of catastrophic damage. Shrapnel wounds across his chest and abdomen, compound fractures in both legs. Blood pressure so low the monitors could barely register it. 3 surgeons stood nearby, reviewing scans with expressions that said they were calculating how to document an inevitable death. Survival probability less than 5%. One resident said quietly. Even if we operate, the damage is too extensive. Liver laceration, splenic rupture, possible cardiac contusion. He'd never survive the procedure. Elena stepped forward. I'll take him. Colonel Harlow appeared at her shoulder. Dr. Vasquez, this patient requires resources we can't justify for outcomes this poor. Standard protocol. Standard protocol lets soldiers die when the math doesn't favor survival. Elena met his eyes with something harder than defiance. Certainty born from experience that Harlow couldn't quite place. I don't practice standard protocol. I practice combat medicine. And combat medicine says you fight for every life until there's nothing left to fight for. She was already scrubbing, already planning the surgical approach that would require techniques most civilian surgeons had never heard of, let alone attempted. The operation lasted 14 hours. 14 hours of Elena's hands moving through damaged tissue with the precision of someone who'd operated in conditions that made a fully equipped OR feel like luxury. She repaired the liver laceration using a modified technique that minimized blood loss. Salvaged the spleen when protocol said to remove it. Stabilized the cardiac contusion through a procedure that existed in exactly 3 medical textbooks, all of them written for battlefield surgeons. When Torres's vitals finally stabilized, the entire surgical team stood in exhausted silence, staring at monitors that showed a heartbeat where none should exist. Outside the OR, a group of Rangers waited. Torres's team, faces hard with the particular grief of soldiers who'd already begun mourning their brother. Elena emerged still in surgical scrubs, blood-stained and exhausted, and met their eyes. He's stable. Critical, but stable. If he continues improving, he'll make a full recovery. The team leader, a sergeant with scars that mapped a career of close calls, stepped forward, studying Elena's face with intensity that went beyond gratitude. Ma'am, his voice was quiet, careful. Sergeant Malik Torres is my brother. Has been for 8 years, since we served together in Afghanistan. He paused. At Camp Vanguard, 2019. Were you, Dr. Vasquez? Colonel Harlow's voice cut through the moment like a blade. He stood in the corridor, face pale, expression tight with something between shock and urgency. General Blackwood's delegation arrived early. They're requesting immediate tour of all trauma facilities. His eyes locked on hers. He's here now, and he's asking questions about the surgeon who just performed a 14-hour miracle on a patient everyone else had written off. The Rangers watched her with dawning recognition. Harlow watched her with certainty about secrets she could no longer contain. And somewhere in the hospital, General Marcus Blackwood, the man who'd destroyed her career 8 years ago, was walking toward a confrontation that would finally force Elena to stop running from who she was. Elena had nowhere left to hide. She considered the surgical wing her sanctuary, the one place where protocols demanded focus over questions, where gloves and masks provided anonymity, where the work itself became armor against exposure. But General Marcus Blackwood's inspection was methodical, thorough, the kind of assessment that left no corner unexamined. He moved through Fort Brennan with an entourage of officers, reviewing trauma statistics that showed an impossible transformation. Mortality rates dropped 43% in 3 months, surgical success rates climbing to levels that defied civilian medical standards. Who's responsible for this improvement? Blackwood's voice carried through the corridor outside the surgical wing. Deep, authoritative, exactly as Elena remembered from tribunals and nightmares. New trauma surgeon, Colonel Harlow replied. Dr. Elena Vasquez. Exceptional skills, though her methods are unconventional. I want to observe her work." Elena was mid-surgery when they entered the observation deck, a complex vascular repair on a young corporal with shrapnel damage to his femoral artery. She kept her back to the window, mask up, surgical cap covering her hair, voice neutral as she called for instruments. Clamp, suture, more light on the operative field. Through the intercom, Blackwood's voice filtered into the OR. "Dr. Vasquez, impressive technique. Where did you complete your vascular surgery fellowship?" Elena's hands didn't pause. "Multiple institutions, General, Iowa primarily. That repair pattern, the way you're approaching the arterial damage from a posterior angle rather than anterior access. That's not standard protocol. It minimizes tissue trauma and reduces recovery time." Elena focused on the delicate work of reconstructing blood vessels, refusing to look up toward the observation deck where she could feel his eyes cataloging her movements. "I've seen that technique before." Blackwood's tone shifted, sharpening with recognition not yet fully formed. "Once. Afghanistan, 2019. A combat surgeon performed an identical repair under fire, saved a soldier's leg when amputation was the only viable option according to every other physician present." Elena's hands stilled for a fraction of a second, long enough for the surgical team to notice, short enough that the patient remained stable. "It's an effective approach, General." Her voice stayed carefully neutral. "That surgeon called it the posterior preservation technique. Later, other doctors called it the Reyes maneuver, after the captain who invented it." Blackwood's voice dropped, heavy with certainty. "Only one surgeon has ever performed it successfully under combat conditions. Captain Elena Reyes, who was court-martialed and discharged 8 years ago for insubordination." The surgical theater went absolutely silent, except for the steady beep of monitors measuring a heartbeat that Elena was fighting to keep regular. She completed the final suture with hands that had suddenly gone cold, then slowly, inevitably, turned to face the observation window. Through the glass, General Marcus Blackwood stood frozen, his expression cycling through shock, recognition, anger, and something else Elena couldn't quite identify. Not quite regret. Not quite relief. Something more complicated than either. "Captain Reyes." His voice came through the intercom like a judgment. "Or should I say Dr. Vasquez?" The pause felt like falling. "We need to talk. Now." Elena stripped off her gloves, the surgical team staring at her with expressions mixing awe and confusion. She'd saved lives. She'd broken rules. And now the man who'd destroyed her career 8 years ago stood waiting with answers to questions she'd spent nearly a decade trying to forget. There was nowhere left to run. No identity left to hide behind. Just the truth. Finally catching up in a military hospital where soldiers lived because she'd refused to let the past dictate who she could save. Colonel Harlow's office had never felt smaller. Elena stood near the door, still in surgical scrubs, aware of every eye in the room tracking her movements. General Blackwood sat behind Harlow's desk like he owned it, which technically, during an inspection he did. The hospital's senior leadership filled the remaining chairs. Department heads, administrative officers, medical directors. An audience for her exposure. "Ladies and gentlemen," Blackwood began, voice carrying the weight of command. "The surgeon you know as Dr. Elena Vasquez is actually Captain Elena Reyes, former Army trauma surgeon, discharged following court-martial in 2019. The room erupted in whispers. Elena stood silent, watching 8 years of carefully constructed identity collapse in a single sentence. Captain Reyes was stationed at Forward Operating Base Vanguard during a Taliban siege. Blackwood's tone hardened with each word. "When I gave the order to evacuate medical personnel, she refused. Disobeyed a direct command to abandon 12 critical patients who'd been declared expectant. Too wounded to survive transport. They couldn't be moved," Elena said quietly, her first words since entering the office. 3 had open chest wounds. 4 were actively hemorrhaging. 2 were mid-surgery. Evacuation meant certain death. Staying meant risking 200 personnel. Blackwood's voice rose. "You jeopardized an entire forward operating base, endangered every soldier under my command, for 12 patients we'd already written off. That's not medicine, Captain. That's emotion overriding judgment." Those 12 patients survived." Elena met his eyes with 8 years of anger finally finding voice. "Every single one. Because I refused to let mathematics decide who deserved to live. I stayed 11 hours under mortar fire, performed 6 emergency surgeries in a collapsing tent, and when reinforcements arrived, all 12 were stable enough for evacuation. And if the enemy had overrun our position? If you'd been captured or killed? If your decision had cost lives instead of saving them? Blackwood leaned forward. Command isn't about individual heroics, Captain. It's about calculated risk and acceptable losses. Acceptable to whom? Elena's voice cracked. To the commanders making calculations from safe positions? Or to the soldiers bleeding out because the math doesn't favor their survival? The silence that followed felt like a held breath. Then Nurse Rachel Park stood, tablet in hand. General Blackwood, if I may. She approached the desk with clinical precision. Since Dr. Vasquez, Captain Reyes, arrived at Fort Brennan 3 months ago, our trauma mortality rate has dropped 43%. Surgical complication rates down 37%. Recovery times improved by an average of 12 days. Dr. Samuel Chen stepped forward from where he'd been standing near the back. General, I've reviewed every case she's handled. 16 patients are alive today who would have died under standard protocols. Sergeant Kessler, tension pneumothorax missed by 3 other physicians. Captain Fisher, cerebral aneurysm hours from rupture. Private Chen, clinical death reversed through a procedure most surgeons wouldn't attempt. Those outcomes don't justify. Blackwood started. The door opened. Sergeant Malik Torres stood there, IV pole in hand, hospital gown showing beneath a borrowed jacket. He should have been in ICU, sedated, recovering from surgery that had saved his life against impossible odds. Instead, he stood at attention, as much as his injuries allowed. General Blackwood, sir. Torres's voice was weak, but clear. Permission to speak. Blackwood's expression shifted. Surprise mixed with something that might have been concern. Sergeant, you should be... 14 hours ago, 3 surgeons told my team I was already dead. Said my injuries were too extensive, survival probability less than 5%. Standard protocol was to let me go. He paused, breathing carefully around damaged ribs. Captain Reyes refused to accept it. She operated for 14 hours and brought me back from the dead. Whatever she did in Afghanistan, whatever choice she made that got her court-martialed, she's still making it here, still choosing soldiers over statistics. Torres met Elena's eyes across the room. She saved my life, sir. Same as she saved those 12 soldiers in 2019. Maybe that makes her insubordinate. But it also makes her the kind of surgeon every soldier hopes is on duty when they get hit. The office fell silent, except for Torres's labored breathing and the distant sound of hospital monitors measuring heartbeats that Elena had fought to preserve. General Blackwood sat motionless, his expression unreadable, while 8 years of judgment hung in the balance between vindication and condemnation. Everyone out. General Blackwood's voice carried no room for argument. Captain Reyes and I need to speak privately. Colonel Harlow hesitated. General, with respect. That's an order, Colonel. The room emptied slowly, medical staff filing out with backward glances at Elena. Nurse Park squeezed her shoulder as she passed. Dr. Chen nodded with quiet encouragement. Sergeant Torres saluted before limping back toward ICU. Then the door closed, leaving Elena alone with the man who'd destroyed her career 8 years ago. Blackwood stood motionless for a long moment, staring at her with an expression she couldn't decipher. Then his military bearing cracked, shoulders sagging, hands bracing against the desk like he needed the support. Do you know what happened after you were evacuated from Camp Vanguard? His voice was rougher now, stripped of command authority. I was court-martialed, discharged. My career ended. Elena's words came hard. I know exactly what happened. No. Blackwood looked up, and Elena saw something in his eyes she'd never seen during the tribunal. Grief. You don't know the rest. Those 12 patients you refused to abandon? We extracted them safely. All 12 survived transport, recovered fully, returned to duty or civilian life. He paused. The enemy overran Camp Vanguard 40 minutes after the last helicopter left. Elena felt the floor shift beneath her feet. If you'd evacuated on schedule with the rest of medical staff, you would have been on the first transport out, which means you would have been airborne when the Taliban hit our convoy route with RPGs. Blackwood's voice cracked. 3 helicopters went down. 17 personnel killed. If you'd followed my orders, Captain, you'd be dead. A name on a memorial wall instead of standing here saving lives. The words hung between them like smoke from old fires. You court-martialed me. Elena's throat tightened. To save my career? The alternative was charging you with reckless endangerment, which carried prison time. Dishonorable discharge. Blackwood moved around the desk. No longer a general, but a man carrying 8 years of guilt. I gave you insubordination. A black mark, yes, but one that let you keep your medical license, start over somewhere else. I thought... He stopped, composing himself. I thought I was giving you a second chance. You destroyed everything I worked for. Tears burned behind Elena's eyes. I spent 8 years hiding, building new identities, terrified someone would recognize me. I know. The words came out broken. And I've spent 8 years believing I destroyed the best combat surgeon I ever commanded. The tribunal ate at me every single day, wondering where you went, if you were even practicing medicine anymore. His voice dropped to barely a whisper. And then I walk into Fort Brennan and see surgical outcomes that defy every statistical model, techniques that only one surgeon in the world performs. And I realize, you've been here all along. Still saving lives nobody else will fight for. Elena stared at him, watching years of anger recontextualize into something more complicated. Why didn't you tell me? During the tribunal, after... Why not explain? Blackwood met her eyes with brutal honesty. Because you needed to believe you'd failed. If I'd told you the truth, that staying behind saved your life, that your disobedience was the only reason you survived, you would have gone right back into combat zones, volunteered for the most dangerous deployments, pushed your luck until it finally ran out. He paused. I couldn't watch you die, Elena. So I made you hate me instead. The silence that followed felt like all 8 years of misunderstanding collapsing into clarity neither of them wanted. And Elena realized the man she'd spent nearly a decade resenting had actually saved her life twice. Once by ordering her evacuation. Once by making sure she could never return to the war that would have killed her. The main auditorium at Fort Brennan held 300 personnel. Every doctor, nurse, medic, and administrative officer on base. They filled the seats with the tense energy of people summoned for an announcement that would change everything. General Marcus Blackwood stood at the podium, dress uniform perfect, bearing rigid with military precision. But his voice, when he spoke, carried something other than command authority. It carried truth that had waited 8 years to be spoken. The surgeon you know as Dr. Elena Vasquez is Captain Elena Reyes, Bronze Star with Valor. Combat Medical Badge, 47 confirmed saves under fire during the siege of Camp Vanguard in 2019. He paused, letting the words settle. She was court-martialed for refusing evacuation orders, for choosing 12 dying soldiers over military protocol. I was the commanding officer who brought those charges. The auditorium went absolutely silent. I stand before you today to say that judgment was wrong. Blackwood's voice cracked slightly. Captain Reyes didn't fail her duty. She elevated it. She proved that medical ethics don't end where military orders begin. He looked directly at Elena, standing near the back. And she spent 8 years hiding from recognition she earned in blood and sacrifice. Elena felt 300 pairs of eyes turned toward her. I am formally requesting Captain Reyes's reinstatement to active duty, not as a field surgeon, but as Director of Trauma Medicine for all military medical facilities. A position that will allow her to share her techniques, train the next generation, ensure that every soldier has access to the kind of medicine that refuses to accept acceptable losses. The auditorium erupted in applause. Staff Sergeant Torres stood, still recovering but upright. Private Chen, cleared from ICU, joined him. Captain Fisher, the pilot whose life she'd saved, saluted from the third row. One by one, the soldiers Elena had refused to let die rose in recognition of the surgeon who'd made mathematics irrelevant in the calculus of survival. But Elena remained motionless, feeling the weight of expectation that came with rank and recognition and positions that would take her away from the work that actually mattered. General Blackwood, her voice cut through the applause. I'm honored, truly, but I decline. The silence that followed felt shocked. I don't need rank or recognition. Elena stepped forward, finding words she hadn't known she needed to speak. I don't need a position that puts me behind desks and organizational charts. I need to do what I was always meant to do, save the soldiers nobody else will fight for, the ones the statistics say are already dead, the ones protocol says aren't worth the resources. Blackwood studied her for a long moment, then nodded with something that looked like understanding mixed with respect. Then perhaps a compromise. You remain at Fort Brennan as trauma surgeon, but you establish a training program. Share your techniques with military surgeons worldwide. Teach them to see what you see, fight how you fight. Elena considered the offer, feeling the weight of 8 years finally lifting. The Tactical Trauma Institute, hands-on training, no classroom theory, just real techniques for impossible situations. Agreed. 6 months later, Elena stood in the converted surgical wing that now housed the Tactical Trauma Institute's first training session. 40 military surgeons from 12 countries filled the observation deck, watching her demonstrate the posterior preservation technique on a simulation model. Colonel Harlow sat in the front row taking notes. His earlier skepticism transformed into respect earned through outcomes that spoke louder than credentials. After the session, Elena walked through the hospital courtyard at sunset, visiting the soldiers who'd become living proof that refusal to accept mathematical certainty could change outcomes. Private Chen recovered fully, preparing to complete basic training. Sergeant Torres, cleared for light duty, already talking about returning to his team. Captain Fisher, back in the cockpit, flying missions that would have been impossible if she'd accepted that sentinel bleeds were just migraines. Elena stood alone watching medevac helicopters land with new casualties, soldiers who would bleed, fight, and maybe survive because someone refused to let statistics write their obituaries. She was exactly where she belonged, not hiding from who she'd been, but finally becoming who she was always meant to be. A surgeon who chose lives over protocol, patience over politics, and humanity over acceptable losses. The blood on her hands had stopped bothering her years ago, and now, finally, the silence afterward didn't haunt her anymore either.